already assembled for you, so you don't have to figure out where anything goes. So you get nervous when you're recording me. Okay. So on the film, you'll see the writing is on the outside through the clear portion of the barrier. What does it say? Opposite side toward tube. Mm-hmm. Right? So how are you putting this in here? Is that right? If your patient's biting here and it says opposite side toward tube and your tube's going here? No. So you need to see the black side. So you're going to put your dot in the slot, opposite side toward the tube. Literally, you put this in the mouth. Your patient's biting here. Their cheek is here. This is outside. You're going to take, let's pretend we're doing this. And it's the same for both. You just flip it. Obviously, this is going to be barriered. Do you see this seam in the PID? You're literally going to line this up like a puzzle piece. If you do this, what's going to happen?
It's going to come out wrong.
What's going to be wrong with that?
You're going to get the not open contacts. Or it's going to be
Look
slanted.
at where the...
It's going to be a cone cut.
Right,
Oh.
see where the film is?
Yeah.
Okay. If you do this, what's going to happen?
Cone cut.
And what did you just say?
It's going to be slanted.
The contacts are not going to be open because now you've changed what kind of angulation?
Horizontal angulation.
What kind of angulation is this?
Vertical.
Right, what happens if you're like this?
Elongated or short something.
Foreshortened?
Foreshortened.
Elongated?
Yep.
Something short, I knew.
That's it. That's how you use this. So you expose your radiograph, right? You can put this down here. You can put this down, put the black side up so less light penetrates for the time being. If you don't have a clinical assistant, you have to expose all your radiographs, put them down, and then disinfect, right? They can stay for at least 30 seconds to a minute and nothing will happen. But I'd rather you not wait that long, just in case. Okay, so say you got all your films. You're gonna have this box open, right? As you wipe them down, you'll kind of slide them through the wipe and they'll drop here. This is clean, by the way, that's why I dropped that in there. Okay? Put them in here, close the box. It has to be closed completely. I'd rather you wipe, like if you have a clinical assistant, you're gonna have somebody that's dirty, that's exposing, and somebody that will be wiping them down, putting them in here as you take them. I'd rather that happen. But you're not always gonna have that luxury of having somebody there to wipe down your instruments. Film and put them in here, okay? When you go to open this and process them through here, you have to have new gloves on, clean gloves, okay? So let's pretend we're there. So you're gonna open this barrier. Now you might still have cavi wipe residue, right? Don't get that on the film. So what you're gonna do is keep these two fingers to open, and then you can use these two to pull them out. That way you have dry fingers. And then you're gonna do dot in the slot writing towards you. And you have to give it a little push, and it'll take it in, process it, and drop it at the bottom. And then you can put the next one in.
Okay.
It's easy.
So that is the
What were-
barrier
This is the
that
barrier.
you just pulled.
This is the barrier.
So we're gonna take that off before we put it in the box? Or
Before you put it in here.
And once it goes in there, that it's erased from this.
Yes, it's gone forever.
So that's what we keep.
Yes.
Okay.
This is gonna be here. It's gonna drop down. They're all gonna stay there until you rebury them and put them back.
Okay.
But they're not to leave this area unless they're barriered and going home.
Okay. And when we take the film out of there, we have new gloves on.
Yes.
And we don't have to re-glove after.
They can stay in here for as long as you want. And they're not gonna be affected. So if you say, hey, Mr. Carley, I need to go back to my patient. Can you put those through for me? Sure. I'll put my gloves on. I'll process them for you. And then I'll take a look at them right away. Because I'm looking at the films while the patient's in the chair. Before I do a data check.
When should we not ask for your help? Like when are you like super busy when we shouldn't?
You'll know.
Okay.
You'll know. There's certain things you can be self-sufficient with.